Have you ever felt a strange tightness in your chest while walking up a flight of stairs? And then, just a minute later, it faded away. You pause for a moment, maybe take a deeper breath, wait a few seconds, and then continue with your day as if nothing happened. You tell yourself it was probably nothing. Maybe stress, maybe something you ate. And honestly, most of the time, that's exactly what it is. But sometimes, when the body repeats a sensation, it's worth paying attention to the pattern, not out of fear, but out of understanding. This is warning sign number 3 in the 100 Warning Signs series, a series built around one simple idea: understanding what your body may be trying to communicate before problems become impossible to ignore. Today, we're talking about occasional chest discomfort. Not severe chest pain, and that difference matters more than many people realize. Most people imagine heart-related symptoms as something dramatic, sudden, intense, impossible to miss. But in reality, the body often starts much more quietly than that. Long before major symptoms appear, it sometimes sends small signals first, and occasional chest discomfort can be one of them. Now, it's important to say this clearly from the beginning. In many cases, mild occasional chest discomfort turns out to be completely harmless. One common cause is simple muscle tension, especially in people who sit for long periods, carry stress in their shoulders, or have had a physically exhausting week. The chest wall contains muscles and cartilage, and just like any other part of the body, those structures can sometimes feel tight, sore, or slightly uncomfortable under strain. Acid reflux is another very common explanation that people often mistake for something heart-related. The esophagus sits directly behind the heart, so when stomach acid rises upward, the pressure or burning sensation can feel surprisingly similar to discomfort coming from the chest itself, especially after a heavy meal, while lying down, or during stressful moments. Anxiety and emotional stress can also create very real physical sensations in the chest. When the body is stressed, breathing often becomes shallower, muscles tighten, and the chest can begin to feel restricted or heavy, even when nothing dangerous is happening physically. And that's what makes this confusing. Many completely different causes can feel surprisingly similar. So what separates ordinary chest discomfort from something that may deserve medical attention? Usually, it's not just the feeling itself. It's the pattern around it. If mild discomfort happens rarely, settles quickly on its own, and doesn't seem to become more frequent over time, it often turns out to be nothing serious. But when that same sensation starts appearing more predictably during physical activity, walking faster than usual, climbing stairs, carrying shopping bags, and then eases once you stop and rest, doctors pay much closer attention to that pattern. Because the heart, like every muscle in the body, needs oxygen-rich blood when it's working harder. And when blood flow doesn't fully meet that demand, some people experience pressure, heaviness, tightness, or a mild squeezing feeling in the chest during activity. Doctors call this angina, a symptom that can happen when the heart muscle isn't getting enough blood flow during exertion. And this is where awareness becomes important. Stable angina itself is different from a heart attack, but chest symptoms should never be ignored if they begin happening more often, feel stronger than before, or start appearing in new situations. The people who miss these early signs are usually not people ignoring severe symptoms. They're ordinary people who noticed something small, explained it away, and assumed it probably didn't matter. But there is one detail people often overlook, and it's the detail doctors care about most. It's not simply the discomfort itself. It's the consistency of when it happens. If the same mild tightness keeps appearing during the same level of effort, not randomly, but repeatedly, that pattern matters. Sometimes the body notices changes quietly and consistently, long before we fully recognize them ourselves. The reassuring part is this: awareness at this stage can genuinely make a difference. Not panic, not fear, just the simple decision to mention the pattern honestly to a doctor and allow a professional to decide whether further evaluation is needed. Most people who do that discover a manageable explanation, and for those who don't, recognizing the pattern early can make an enormous difference. Your body communicates constantly. The goal of this series isn't to scare you, it's to help you understand your body a little better, to recognize the difference between the body simply reacting to everyday life and the moments when it may be asking for a little more attention. And in the next warning sign, we'll look at another subtle change people often dismiss at first, only to realize later that it was worth understanding sooner. If this felt useful, this series was made for exactly that, one sign at a time, helping people understand their bodies a little more clearly.